Yeah, Brandis, some doctors are calling the upcoming flu season a twindemic. And as flu season starts in the fall, the country is still grappling with the spike in COVID-19 cases driven largely by the Delta variant. Joining us to talk about how to protect yourself against the flu is Dr. Lisa Ravindra, an internal medicine primary care physician with Rush University Medical Center. Dr. Ravindra, thank you for joining us tonight.
Thanks for having me on.
So there were concerns last year about a twindemic, and it didn't really materialize, at least with the flu. Why not?
Yeah, that's right. We first started hearing about the concept of a twindemic last fall, going into our first winter with COVID, and then the concern that on top of the burden that COVID was putting on our medical system, that we were worried about flu also burdening further the hospitals. It didn't actually pan out, which is a good thing, but I think there's a lot of reasons why that didn't happen last year. We were under really strict COVID measures to mitigate COVID. People were masking, people weren't going to school and work like they are now. And a lot of people got the flu vaccine. More people than usual got the flu vaccine last year. In fact, a lot of my patients were really eager in getting the vaccine before I even would bring it up at visits, knowing that they didn't want to have both illnesses be an issue in the winter.
So a lot of factors. What are doctors predicting for this upcoming flu season, noting that kids are by and large back in school?
Yeah, so the flu season is notoriously hard to predict. So we still have to find out. So I'm hoping that our warnings last year were able to convince people to get the flu shot, and this year we'll do the same. But it looks like there's several models that are predicting a very severe flu season, and that's because kids are back in school, people aren't masking as much, aren't doing the same measures. But also for a few different reasons. Usually, even if people aren't exposed to or don't get symptoms from the flu, they're still exposed to the flu at some point during a flu season and develop some antibodies that carry over into the next season. But since there was no flu circulating last year, most people didn't get exposed. So their immunity level or antibody level is going to be much lower and have older antibodies that may not be able to fight the strain that's coming out.
So the downsides of not having a very robust flu season, and as I understand, kids are vectors of the flu, so does it stand to reason that if they're back in school and they're in tight quarters, they might spread the flu, to the general population?
Yeah, absolutely. And it's super important for anybody over the age of 6 months, children included, to get the flu vaccine. And I would say start getting it now. We just got flu vaccine into my office at Rush River North, and I'm advising all of my patients to get vaccinated as soon as possible. There's no reason to wait, so do it now.
What about concerns from people that took the COVID-19 vaccine and wonder, is it safe to take the flu vaccine in close proximity?
Yes. So initially, when the COVID vaccine came out last winter, we were advising patients to wait 14 days between getting any other immunizations, but that recommendation is gone now. It's safe to get all the flu shot and the COVID-19 vaccine all together at the same time, same day. There's no reason to space them out. So if somebody's eligible for the booster shot or the third shot, I recommend getting everything as soon as possible.
Going back to, you're saying models are predicting a pretty heavy flu season, beyond kids being in school, maybe not social distancing as much. What are the other factors that go into that modeling?
So in years past, we've looked at the southern hemisphere, so countries like Australia, to see how their flu season went, and because they have flu season during our summer, so theirs is just ending now. They had a very light season again this year, but they're also much more strict about COVID measures, and not their borders are still mostly closed, and so I don't think that we can really base it on their model because we're functioning differently in our country. But yeah, there's a lot of factors that go into it. And a lot of times we use the strains from previous seasons to predict strains of the flu this year, but it's much harder to do when the flu was so light last year.
All right, a lot of things for parents to watch out for on top of COVID and being back in class. And our thanks to Dr. Lisa Ravindra. Thanks so much for joining us.
Thanks for having me.